Hey everyone, it's Tim from Linessa Farms, specialty in heirloom livestock. Thanks for joining us again today. I am super excited to bring you this video. Well, I don't know if it's about something that we should be super excited about, but so many of you over the years have asked about this, and we are finally covering this. And this is scours. And if you don't know what scours are, well, you probably do. It's poops, diarrhea, can't say some of the other words, but you know what it's about. And this is something that affects so many sheep and goat babies and adults as they age and as they progress through the seasons and through the year. Stay tuned to find out more. All right, so here we are in the shop, and we want to talk about scours and diarrhea. Now, there are four major causes of scours or diarrhea in your baby goat or in your baby lamb. The first one, and probably one of the more common ones, is bacteria. Now, this can be caused by multiple different bacteria, such as E. coli. And then we get into viruses. You can get herpes viruses, all kinds of different viruses. So what do we do to determine if we've got a bacteria or a virus? Well, this can be very difficult to discern. When we do our overall evaluation on the baby, so let's say that you go out to your field or we go out to our pasture and we see that we have a baby that is suffering from scours. We want to do an overall assessment on that baby, and we want to determine what is it that is causing this baby to have scours. And one of the most important things that you can do as a producer or as a small farm raiser of sheep or goats is to take a core body temperature. We want you to take a thermometer, we want you to take a rectal temperature, and we want you to see if the temperature is over or above 103.5 degrees Fahrenheit. If it is, there's a very, very good chance that your baby is suffering from a bacterial infection or a virus. More than likely, if you don't see sores around the mouth, extreme drainage from the eyes, or drainage from their reproductive organs, they are suffering from a bacterial infection, and this can be treated with antibiotics. The environment is another major source of scours in sheep and goats, and this can be caused by a multitude of things, mainly dirty or just disgusting areas where they live. Are they living and walking and eating and sleeping in feces? And do they have dirty water? Now, of course, we always want to keep very, very clean water, but what you'll determine over time is you can have a completely clean container of water for these animals to drink out of, and they decide they're going to go drink out of a mud puddle. So even if you do your best, is the point that I'm trying to make sure that their environment is very, very clean, these are all things that you have to keep in mind. Now, the very last one that we've talked very, very much about, and you can see some of our videos, if you look through our video load on YouTube, is we talk about worms and parasites. And these are very, very common things that cause a worm load and parasite load in our animals, the barber pole worm and coccidia. And these can be things that cause a diarrhea or scour to happen in the animals as well. Obviously, if we have a bacteria, we're going to treat with antibiotics. Consider LA200 and other antibiotics such as penicillin, so on and so forth. As far as the virus is concerned, this is very, very difficult to treat, just as it's very, very difficult to treat in humans. Most of the time, you can let this ride itself out and it will tend to correct itself. The environment, this is one of the most easy things to fix on your own. You just need to make sure that you clean up your area, clean up any stray water, and make sure that your animals have a healthy, clean living environment to stay in. As far as the worms and parasites, I'm not going to get into this too much because we have tons and tons of videos about that, which I strongly encourage you to check out. So with that being said, let's move forward. All right, so after you've done your basic inspection on the animal to check to see if they're suffering from a fever, there are a few different things that you can do. The first and foremost thing that we expect you to do and that we advise that you do is to treat with Spectam. Spectam Comes in many different names. This is a trade name. The active ingredient in this is spectinomycin, and you're going to want to treat your animals accordingly for that, and we're going to talk about that here just in a minute. On top of this, I would advise that you consider a injection of LA200, penicillin, or Nuflor. Again, we want you to talk to your veterinarian about this to determine if this is correct for you. Now, if we have a virus, these two, again, very, very difficult to discern if we have a bacterial infection or a virus infection. Essentially, you're going to treat them both the same because it's impossible for you to determine if it's a virus or a bacteria. Giveaways of virus could be ORF, or sore mouth around the mouth, or on the teat structure, or some kind of discharge coming from various parts of their body. Again, we expect you to treat them both the same. Again, just go with the Spectam, the LA200, penicillin, or Nuflor. Now, one thing to note about treating for a bacterial infection is these medications can actually kill the good and the bad gut flora that's in the gut, and it can lead to a short-term round of scours or diarrhea, so that's something to keep in mind as well. Again, environment, just clean it up. Worms and parasites, we've got videos about this ad nauseum, so just check them out and worm your animals as you deem appropriately. All right, so as we talked about in the shop, there's 4 basic elements that go into scours. We have bacterial infections, we have viral infections, we have environment, which is things like dirty water, dirty food, and then of course we have worm loads. Now, assuming you don't necessarily meet any of these criteria, there are a few things that you can give. So we've got our Spectam here, and this is basically an antibiotic, and antibiotics are used for bacterial infections. But we also start getting into kind of the people medicines. This is basically just upset stomach. And this is what you're going to run into when your lambs and your goat kids get to be in that transition period where they're transitioning between just getting milk from mom and getting some grain. Because as you know, we're big fans of having our animals on creep feed. You can check that out right here. So if we've just transitioned to sheep or goat creep food, you can plan on having a little bit of upset stomach, and this is where the Pepto-Bismol or the kaopectate comes in very, very handy. I have no problem whatsoever with using the Pepto-Bismol or the kaopectate. These work really, really well to coat and soothe the stomachs. What you don't want to use is Imodium. Imodium is a medication in the medical field that we refer to as an anticholinergic, and what it does is it actually slows down the flow and the motility of the large and small intestines, and it can lead to really, really bad things like constipation that causes a complete bowel obstruction and other things. So if you're going to use the people medicine, if you don't meet any of the criteria of temperature or anything like that, and you know you've recently transitioned on feed, Pepto-Bismol is okay and the kaopectate is okay. Again, you want to make sure that you know what you're treating before you start giving medication. All right, so you have to excuse the noise. We have this little baby here, and it has had scours. So I've already done everything that we talked about. I've checked the eyelids, I've checked the temperature, I've done a basic overall checkup of the baby, and what I've determined is she's got a little bit of a temperature, she's got a little bit of scours. More than likely she needs some Spectam, and I'm going to go ahead and give her some Spectam. We give about 1 ml per 5 pounds. And so the easiest way to do this, you just take your Spectam, draw it up in your oral syringe. I always would see she's automatically going to want to drink off of that. You just give her a little bit at a time. It's not a race. Give her a little bit at a time. Let her drink it up. You don't ever want to give this to a baby that's not drinking. And just take your time. There you go. And that's it. All done. It's just that easy. So again, this is going to depend. This is going to depend on what you find when you do your overall assessment of the baby. All right. All right, so I'm Tim from Linessa Farms, Specialty in Heirloom Livestock. Thank you so much for joining us again today. We so much appreciate that you view our channel and that you subscribe and that you give us your feedback. And we hope that this basic introductory video to scours and diarrhea is helpful for you. We plan on making many, many more to deal with very specific types of diarrhea and scours, but we thought that this would be a great way to get you started. If you have any questions, if you have any comments or concerns, make sure that you leave them below. Lots and lots of people read these, so if you have a question, chances are other people have a question as well. Don't be shy, put it down below, reach out to us, contact us, and we will be happy to answer your questions. I'm Tim from Linessa Farms, Specialty in Heirloom Livestock. Thanks for joining us again today, and I look forward to seeing you again next time.